places, again, I would say I lived in a neighborhood that I normally would not have ended up in. And I, experienced facets of urban poverty. Bedside by that point was gentrifying pretty quickly. But when I initially moved there, I remember experiencing the food desert and various other things and whatnot. So, and then I worked at, Metropolitan Hospital was a county hospital. So it's a safety net hospital that serves all of New York City, regardless of your ability to pay. So in East Harlem, it was largely a Latino population. I'd say about 50% of my patients didn't speak any English. Probably about 20 to 30% were undocumented. A decent amount were homeless. That was kind of a separate population, but also there. And then the rest of my rotations are at largely Harlem Hospital, which is a pretty special place because it's a Black hospital. It's run largely by Black doctors, Black leadership, and takes care of a mainly African-American and African population at this point, at least when I was there 5 years ago. And I had a little bit of Westchester Medical Center sprinkled in. And then later I worked in Staten Island, Tennessee, New Jersey, and now I live and work in California, mainly in Bay Area hospitals. So,
all right. So you've made the rounds. You've seen quite a lot. You've been in a lot of different situations and areas. So
so that's the kind of backdrop in which I'm coming to this conversation from, is seeing pockets of healthcare in various parts of this country over, like, I'd say now almost the last 10 years. And then what happened last year was the COVID pandemic.
Right.
And we were totally on the front lines. I was in East San Jose I work for Healthcare Corporations of America, which is a $50 billion company with something like 225 hospitals. And I believe, from what I understand, is our hospital in East San Jose was one of the hardest hit in all of their hospitals in terms of COVID. I got COVID twice this year.
Wow. Okay.
Yeah, it really sucked. And COVID, by the way, is no joke. Like, even as a young, healthy 35-year-old, I was like sick for a month both times.
Wow.
But by being on the front lines of that pandemic, I saw how that pandemic played out based on your position in society.
Yeah.
And who got to stay home safely and who had to go to work. And who, when they got sick, got one kind of care versus another kind of care. And I honestly spent a lot of the year pretty goddamn angry. It was difficult to see it so clearly crystallize those sort of imbalances and structural inequities in society that I knew were there, but then to see it really like it was life or death.
Exactly, right. Yeah, it becomes different when it's life or death, right? Right in front of your face, and you're like, oh, like
that's. There's gradations of those insults, from insults to dignity, insults to your ability to pursue work, etc. But then when it's life or death, then it was just impossible to not be pissed off, and to not feel personally like I had a responsibility to deal with this.